I'm so excited because we're sitting here in our brand new health center that I consider my dream health center. I've been waiting to have a space like this for a long time, and the college has been able to fund this for us. We used to be located in Carmel Hall, and for anybody who's ever been in our old health center, you will see there's been a significant change. This has been a wonderful thing for our students. We've also added 3 student workers that work with us. One is a lab assistant, and 2 are senior nursing students. And if it wasn't for them, we would have never been able to make it through these last 2 years with COVID. They have made such a significant difference for us.
I've been able to get a lot more hands-on work here than I have even at clinical. I've been able to draw blood here and administer probably close to a couple hundred shots, which has been a great experience.
I get to work with students, staff, faculty, and the community here at St. Joseph's College. I help a lot at the Health and Wellness Center, and I get to put on programming for the whole community, whether it is fitness classes, healthy habits, nutrition, cooking demos, or helping with the pandemic.
My colleague Liz Wiesen and I started around the same time. She started a semester before I did, 23 years ago. And we made it a point to really address mental health stigma and try to reduce whatever stigma exists on campus so that students feel more comfortable reaching out. The number one referral source for students to make use of the counseling center is self-referral. They just refer themselves. And the second most common is not faculty, it's not staff, it's other students who are talking with their friends about the benefits that they've gotten from the counseling center, and they're encouraging their friends to make use of it as well.
So we started exploring different online platforms to see which one maybe would serve both sets of students in a beneficial way, that we didn't have to worry about our licensure and one-on-one therapy. And we came across Togetherall, and amongst others that we researched, we decided to stick with Togetherall. Its global reach and 24/7 accessibility made it really appealing, in that we have students, online students especially, they're older students, they're working students, they're parents, and there's a good chunk of users on Togetherall that fit those demographics. So it's not just geared to your residential young 20s type of student. And so that was one of the things that made it most appealing for us.
So with the support of Community Rising, I would say what we'd like to see happen is we'd really like to build a whole wellness center here, which would include maybe the counseling services, which would be amazing to have them maybe upstairs from us. We'd really like to have funding for that, so we could be one big team and really provide wellness for the entire community here in one spot. That would be something that we would love to do in the future.
With the support of Community Rising, if I envision moving forward, Togetherall has just been a start of what we would like to be. I would like the counseling center being way more than just one-on-one. There's the whole thought of being reactive to issues that people are having, and then being proactive to issues that people may start to have before it even gets to a clinical level. And the concept of a wellness center where we could have maybe a meditation room, or a larger space where we could hold groups or peer support groups. Maybe a room where people could come and de-stress and have some time with one of our canine assistants, just to expand even just infrastructurally so we can offer more supports. That gets me really excited to start thinking pie in the sky of what we can do with just some added space.
We're aware that the pandemic will probably leave us with a legacy of increased mental health need going forward. And being committed to the educational mission of the college, we're really committed to helping students be able to respond to whatever mental health concerns they have. And toward that end, we really have a vision for creating what I would call a wellness center, where we pull together the health center, we pull together some of the yoga and meditative and recreational offerings that Jenna Chase has been putting together, and we pull together the work of the counseling center in kind of a unified wellness center. that can meet a wide range of students' health needs, from physical health to mental health, and just overall wellness.